Good afternoon and welcome to United TV. My name is Kemal Erkan. Today is January 19th, very snowy Delaware day. We got a lot of snow and hopefully everyone is doing well. So we are going to have our second second episode of our political series today. And Dr. Michael Katz is going to join me, and I'm going to let him in right now. And we are going to start our conversation right away. Good afternoon. How are you doing, Dr. Katz?
Hi, Kemal. It's nice to see you.
Nice to see you as well. So, well, thank you for joining us. I'm sure you saw some of our other episodes. Our goal is to bring everyone who's running for different seats in Delaware for 2024, and from either side or right in the middle. So we want to get to know all of our people. So as you know, we are representing also United Medical Accountable Care Organization. In Delaware, we have about 115,000 patients that we serve at the primary care level. And we also have our specialists. With altogether, we probably reach close to 250 to 300,000 lives in Delaware. So this started with our COVID updates in April, actually summer 2020. So then it became something more. And now we have about 33,000 subscribers. And I think we are doing really well from that point. And I'm sure this is going to reach out to a lot of people. So again, today is about you, not about us. So we want to get to know you. So if you can tell us about you, we can start from the personal side. And just because a lot of people may not know you. So then I'll start with my questions.
Sure. Well, congratulations on all your success and your work in healthcare. Thank you for all that you're doing for patients and the medical community in Delaware. You've had great success, and so thank you. I am the 2024 nominee of the Independent Party of Delaware for U.S. Senate. This is the seat that's being vacated by Senator Tom Carper upon his retirement. And I believe it's the first time the seat has been an open election since the 1970s. So it's been a while. I'm a pediatric critical care trained anesthesiologist. I'm a business owner, former Delaware State Senator, and seasoned executive. I'm running for United States Senate to eradicate corruption and the influence of money in America's governance. And in so doing, I'm refusing to take any donations for our campaign. So it's a completely voluntary campaign. And I believe that democracy thrives when the voices of all citizens are heard, free from the influence of money. And all that I'm asking is for all Delawareans to join me in this historic journey to elect Delaware's first independent U.S. Senator who's dedicated to eradicating corruption and really dismantling the influence of money ingrained in the very fabric of our society and government. I grew up in Connecticut in a small town. My mom was the editor of the newspaper at town newspaper, and my dad was actually a small business person, owned a cleaning company, and was a town police officer as well. And did not have a college education, and you really learned early on the value of hard work and value of education from my parents. Went to the town high school. We had one high school, was very involved in student government and sports. And because we were on the beach, we actually got to work on the beach during the summer. So it was a real ideal way to, was very fortunate. From Madison, Connecticut, I went on to earn a Bachelor of Science in Economics. And then from there, I always had a desire to go into healthcare and medicine just because I felt it was the best way that I could help the community and serve people. And so went down to Georgetown and got my MD there, and really had the good fortune. One of the first real good things that happened to me once I was out of home with mom and dad, and that's where I met my wife right before we both actually technically started med school. She's not in medicine, but she's been through all med school and training with me. From there, I went up to Portland, Maine, Maine Medical Center, where I completed my anesthesia residency as a chief resident, and really got involved at that point with state and national healthcare policy at the state level and the national level, which I've really continued throughout my career. Came down to, from there, I actually had the good fortune of continuing in pediatric anesthesia as a pediatric trained critical care physician at Boston Children's Harvard Med School. And from there, really at times in life, I found that sometimes you just don't see things coming, and had the good fortune to be recruited by DuPont Hospital for Children, which is what brought us to Delaware now over 27 years ago. And at AI, I was involved not only in clinical medicine, but had the chance to work with medical students and residents and nurses in education as part of the Jefferson Medical Program. And also was involved with some healthcare management projects and hospital efficiencies and operations. And at that time, the hospital asked me to go get my MBA, which I did while I was working full time. And I did that at Georgetown as well as in the International Executive MBA program. And that was a real good turning point for me. I really got to understand hospital efficiencies, healthcare operations, and the need really for some of the work you're actually doing with integrating services in healthcare. Put together a business plan and worked in Delaware to provide anesthesia services and manage surgery centers, really creating efficient environments where healthcare can be provided to patients in more of a comfortable environment, efficient, where it's not as intimidating as going into the hospital. I also got involved, as I said earlier, I served in the Delaware State Senate and served in several committees working, was able to get some really helpful policy passed that I think is beneficial to the state and to the citizens of the state. So that kind of brings me kind of close to where we are now. It's been, it's been a good journey. I've been very fortunate, and I've always felt that it's, I was brought up to be engaged.
Are you still practicing medicine?
No, I stopped clinical medicine probably about 8-9 years ago. I was actually involved in working and consulting, working with hospitals and health systems nationally in operational efficiencies and health system integration. It's kind of a continuation of what I was doing in Delaware, but more on a broader scope.
So now I do want to actually just put this out there. So because in Delaware it's a small state, and we have this perception of sometimes it's true, but sometimes it's not. So everyone knows everyone here in Delaware, although it's true, but not all the time. So you and I, we were neighbors for 12 years. We never met. Just until 5 minutes before this event, I never met you, right? So I just want to make sure that people who are watching this, sometimes they make their own conclusion. And in some cases, I guess it's hard to believe when we say this. So really, we were maybe 3-4 miles down from where I was in the same development. But in case they look at where we live or where we used to live, yeah. I'm not that more. But it's kind of an interesting world that we live in. So because we never met before, I actually don't know much about you other than I used to hear your name I think with your first term, that was between 2009 and 2013, right?
Correct, yes.
Now, did you run after that, or was it the last time you ran for any?
No, I ran for a second time. And in fact, some of the work I did in uncovering some of the corruption in legislative folly so infuriated my own party. I was a Democrat at that time that literally was gerrymandered out of my district. So it was a challenge. It was a challenging race. It was close, but wasn't successful in the re-election. We had a new district.
So now, did you also run for the president?
So that's interesting. Well, Well, technically, yes. I filed as a presidential candidate in 2020, and that actually came about out of some of the work I was doing nationally with a project that I started called House Calls to Heal America. And that started several years ago when I was working with hospitals and health systems. Whenever I was traveling around the country, I'd always spend time every trip just randomly going to a neighborhood and knock on doors. And what House Calls was all about is really listening to people on their doorsteps, listening to what their issues were, what they were dealing with, problems, everyday challenges, and ultimately what they thought was the how to fix what was broken in their community or in the country. And a friend of mine was actually in New Hampshire, an anesthesiologist up there. So I said, let's bring the program up there. And we actually tried to, he was interested and started running for United States Senator as an independent in New Hampshire. But the challenge in many states is ballot access, which is actually a big issue right now nationally. But as part of that, I was bringing the House Calls program to New Hampshire, and it was a way to get national recognition. We had a lot of support in the community in New Hampshire, not only the medical community, but just people around the state that said, this is an important issue. We want to express, have our voice, and also be able to spread the message of civility, because people are, as we're dealing with now, there's a lot of dysfunction and sort of constant arguments, especially in the political world. So we were speaking with the media up there, and they said, well, we love your message of unity and working together, but we're focused on the presidential candidates. And so they said, if you're a candidate, we'd pay attention to you. So we filed as a candidate to be able to get the message across. However, at that point, they said, well, you're not one of the designated candidates of the party. So that's actually why I entered the race up there, is to try to push that message of civility and working together regardless of party affiliation.
Now, Dr. Ted, probably a lot of people are going to ask you the same question. So before we go to the specific topics, I want these questions to be out of the way. So Delaware is almost now considered like a blue state, right? So and you used to run as a Democrat before. Now you are running as an independent. And I do believe that your name is out there. You have a good name recognition. But do you feel like it's going to be a challenge to win in Delaware as an independent? Maybe the other way to ask you this, why did you not run on the Democrat side for this race?
Well, there's a couple questions there. Yes, it will be a challenge. It is an uphill battle. We've been in Delaware, 27 plus years. We know the state well. It is our home. We're very committed to it and love the state, and want to do well by it. But it will be a challenge, especially as an independent. Even when I served in the state Senate in Dover, I was registered a Democrat. I was actually, lifelong generational Democrat. But however, I just wasn't party line. I was a registered Democrat, caucused with the Democrats, but I didn't, follow what the party line was necessarily, or what I was told to do literally. And I was kind of known as the guy with a stomach of steel there, because I wasn't afraid to stand alone. And matter of fact, worked very closely with the entire Republican caucus at that time, which was small. I think it was about 5 people, but we literally worked hard and almost came close to changing party leadership to really create more of an independent-minded Senate in Dover. But it will be a challenge, and we're up for the challenge. And ultimately, it's up to the voters to decide who they think is the most qualified candidate to serve the state of Delaware and every citizen in U.S. Senate. And I believe that I am.
So hopefully, it's going to be a fair game for everyone. And I mean, this is just going to sound the way it is probably. So when people right now running. And then just because, not what they do, but just because what they represent, having the first Black senator in Delaware, only if it's a good candidate that should be happening, in my opinion. But a lot of people these days, they give way too much credit for those diversity issues, I believe. So I see that as a challenge. So it's a difficult one to overcome. It's a sensitive issue. A lot of people don't want to talk about it. But the qualification is a lot more important than anything in this. And as a physician, you are, and who have business education and experience from both healthcare and from the business side. I think what you are bringing to the table would be very important, and people really should listen and understand what your plans are. So let's go to your plans, and then economy is number one biggest issue. From this U.S. Senate standpoint, there are 100 total people. We get two each. If you were in that position, what are the things that you would do, you're able to do in economy to improve the economy? As you know, a lot of people are complaining about the inflation, the purchase power. Everything is more expensive than what it used to be right before COVID. So, and because of that, I think economy is going to be the number one issue. So we want to kind of hear back from you what your plans are for economy.
Yeah, so I'd like to back up a little bit and talk a little bit about how I function and make decisions and manage. In healthcare as a physician, we think about problem solving, upstream problem solving versus downstream, addressing symptoms. And typically, what I see in legislators, not only at the state level but at the national level, they're downstream problem solvers, meaning in healthcare, we treat problems, the causative problem of an issue or a disease, whereas a downstream example of that would be treating a symptom. So if someone has a cough, someone would be giving them a cough medicine or something to suppress the cough, and that's sort of a downstream solution to an upstream problem, which maybe be a pneumonia. So the upstream problem is the pneumonia, which we need to treat. So when I deal with issues in legislative issues and policies and problem solving, I always try to think, what is the problem we're trying to solve? So in the economy, we obviously want a strong economy, robust economy in which everybody can participate in that economy and be successful, attain the American dream, where they can have upward mobility. That gets into the housing issue as well. Things are very interconnected. So economy is related to education as well, and healthcare. So I sort of think of the pillars, which a lot is based on in our country, is the economy, jobs, cost of living. That's one. And then two would be education and early childhood education, which hopefully we'll have a chance to talk about, which that sort of levels the playing field for people. If they can have a healthy childhood and receive a good education, they can have a choice of what they wish to do in their life and chase their passions in life. And healthcare, healthy living, which is very complex, as you know. It's not just treating diseases, it's actually living healthy lives, the upstream, hopefully thinking upstream so we can change how our healthcare system is delivered and managed, so that we're creating healthy societies, healthy communities, instead of being very good at which we are in treating sickness and disease. With respect to the economy, to have a strong economy, you need strong business. You need a strong workforce, educated workforce, people that are well prepared. And we need an environment where businesses can succeed and don't have barriers to entry, especially small businesses. Our country, and especially Delaware, we rely on small businesses. So we want to take a look at doing everything we possibly can to not only eliminate barriers to entry and regulations, but also find things that we can do to facilitate businesses to start. And that gets to taxes. Taxes serve two purposes, or a couple purposes, more than two, but really one, it's to raise money for the government so that it can support the functions of the government. But two, it also shapes behavior in business. Taxes can, cause a business or individuals not to do something or to decrease the desire in a behavior by taxing it, such as, when we were working for decades and trying to decrease smoking, we would tax cigarettes to try to decrease the elasticity of demand so that people would decrease smoking. With businesses, we can do the same thing, tax incentives to enable businesses to start up, be creative, invest in new ideas, new technology. So it's a multifactorial approach to incentivizing business and the economy and jobs and educating our workforce for the future.
So, well, you said a lot there. So there's a lot of things to do, I've been in this country for 25 years. So now, well, next week I'll be 50. So that means half of my life was here.
Congratulations.
So now, one of the things in this country that what used to be kind of like the feeling of it is just a lot of things wouldn't impact us day to day. So if you work hard, then you get rewarding results, and the inflation was not a huge problem, and all those things. And from my country that I was born, from my home country, Turkey, I used to be so familiar with those issues, inflation use, and still today, like inflation is a huge problem in Turkey. But in the 90s, it was even worse than what it is today. And so I was used to it, and then I got used to what we have in US. And then in the last 4 years again, after COVID, everything changed. So, first time I felt that there was a huge issue was, normally I don't get my own gas. So then one day I was at the gas station and I see like $4.75 or $4.50 for, last time I bought it, it was like $2.50. I'm like, whoa, what happened here? So this was, I think, 2021. And then I realized that issue actually is bigger than that. So, supply chain issue, getting what you need in time, finding people. So I think the world kind of changed. And unfortunately, perhaps this is becoming more like permanent. And that's why one of the things that worries me is if it stays the same this way, how are we going to actually improve from where we are? Because we lost several years with COVID, and we need to kind of get back to the game. But then I think there's some changes happen where it's going to probably impact the election as well. So I think if you get this position, there's a lot of hard work to do. Hopefully, we can see what you're able to do at that time. Now, healthcare probably is one of your focus as it's your background. What are the issues that you see in healthcare that are the most concerning to you? And if you have solutions, or maybe you are already working on those, what type of solutions do you have for those concerns?
Yeah, I just want to step back and comment on a few things that you just mentioned. Some of the challenges that we've seen over the last 4 years with not only in the US, but nationally, as far as how our economies are working, the integration of the economies, the strength of the US economy, and really our position in the world economy, which is weakening. And just what's going on in our society. I mean, there are complex problems going on, and that's actually really the urgency that I feel, which is really, at this stage where I felt that it's time to step up. It's one thing to sit there and watch the news or read the articles and be concerned about it, but it really was one of the primary motivators, thinking about the future of our country and our society and a peaceful world that not only for my kids, grandkids, and all the generations to follow, the good fortune we've had to be in this country, we're all, most of us are from immigrants at some point in our history, and we are fortunate to be here and to live in a democracy and to have the opportunity that we can be the best that we possibly can, and that obligation to also give back to the community and serve our society. With respect to healthcare, we've got some of the greatest capabilities and technology in the world in this country. We've got great medical staff. The nurses, the technicians are so dedicated. They're so dedicated. They're overworked, understaffed, and underpaid, many of them. And the health system is very complex. It's 17+% of our GDP. Touches so many different parts of our economy. Each and every one of us is a patient, so it affects us. And we have to do better. We have to do better with how we spend the money. It's a very expensive system. There are many people that are left out of reaching care. And the objective is to make sure that every person in this country has access to high quality healthcare that's affordable. And for those that can't afford it, I believe we have an obligation to help those in need. I mean, that's just the generous society and how we are as Americans. But it's a very disparate, dysfunctional, fragmented system. The care that you may get in a university or large hospital system in a more suburban city area may be very different than the care that you're going to receive in a very rural area. And so I personally believe, and one thing that I want to work on and have studied and worked on for years, is the integration of American healthcare, so that no matter where you are, that you're getting the same healthcare, and it's really working towards an integrated health system that is a public, private, and nonprofit combination.
So with the health systems, I guess with the healthcare issue, I think one of the biggest problem again is the expenditure and how much we spend. We own private practices, and I also am the managing partner of American Surgery Center. You are probably familiar with that, right on Folk Road. And one of the big problems that we initially discovered is how we get paid versus how the hospital systems are getting paid. So for the same procedure, with the same surgeons, when they do it in our surgery center, I'm going to give the examples from Medicare since they are public. So the gallbladder surgery would be about like $2,200 for the facility. And right now, locally in Delaware, gallbladder surgery averaging about $12,000 in the hospitals. So that's about 6 times more. And every time there is a huge discrepancy for the same service being paid from hospital to the non-hospital systems. It's one, of course, we are business. I'm a businessman, and I'm going to, of course, look after my business. But then from the social side and the community that we live in, now I know that Medicare patient is going to be responsible if they don't have a secondary insurance. They are responsible for 20% of that fee, and the 20% of the 12,000 is almost higher than 100% of the fee that we get paid at the surgery center. So, and with the hospital system being so, the lobbying being so strong, going through that is, and also us being able to compete with those systems from the private business. It's a lot to do. From your for your campaign standpoint, between the hospital and non-hospital providers, do you have any plans for those groups?
For the hospital and non-hospital providers?
In terms of support private practices, maybe I can just rephrase the question a different way. Like private practices, just like my practice and all of my clients, we are competing with these huge, giant systems with very little resources. And the question is, do you have any plans to better support the private businesses in healthcare?
Yeah, so equity, payment equity. And we've dealt with this for years in healthcare, government, fighting for reimbursement for Medicare. Just many practices and facilities have struggled for decades, literally, to not only get paid for the services they provide through Medicare, but also just to be able to cover their costs. I mean, many times, I know most of my career and what I did, we didn't cover costs with Medicare. It was the private contracts that were able to sort of subsidize the Medicare community. Some people opted out of accepting Medicare, but quite frankly, when I was in the operating room caring for patients, I never looked at that. I was involved in the business end of it, but once you're a physician caring for patients, my view was, the first thing priority is do what's in the best interest of the patient, and the last thing you do is in the best interest of the patient, and everything in between. You don't look at who can pay and who can't. You just care for the patients. Unfortunately, in business, you can't keep the doors open, and you're providing a service to the community and to every patient. So yeah, I mean, Medicare is a mess, and they usually look to the providers to try to keep Medicare afloat, but it's really a symptom of the dysfunction of of government funding and of our health system right now. So that's part of instead of, as I talked about downstream solutions, that's really what Congress has been doing for decades, is really dealing with downstream problem solving instead of looking at the whole system and figuring out how can we fix the system. So that's where I'm talking about working on creating, integrating the system and creating efficiencies.
Wait, I guess, maybe put it out there for those may not really kind of see this the way that we do, like finding the problem, being problem oriented, solution oriented, like with the upstream and the downstream. So that I think that's a good way to probably help people to process this. And I think there are a lot of things that I know there are a lot of things out there that we are able to do. The thing is, again, how strong certain lobbying efforts are in different industries, and healthcare, unfortunately, is one of the big ones. And some of those things are difficult. So, but that doesn't mean that we should stop trying, because that's what we have done from United Medical ACO standpoint. So as a private ACO, there are, as you may know, there are 4 ACOs in the state of Delaware, kind of like main core business being in Delaware. 2 of them are hospital systems, and 1 is us, and there's another private one. And because we are competing with the same metrics, with, again, limited resources, but in program year 22 for Medicare, we were number 1 in Delaware and number 17 in the nation out of 482, I believe, total ACOs. So it's doable. So that's what I'm trying to say. But it's just like it puts a lot of pressure on us, and then maybe it makes us stronger. I don't know. But what if people are not willing to do? Some of them are joining the hospital system. I'm sure a lot of your friends who used to be in private practice, they joined the hospital system just because they didn't have an option, right? So that's what we are trying to kind of hoping that we can eliminate those, so that would help the total cost of healthcare. Now, education.
One thing I just want to mention too is that well, go ahead. I apologize to interrupt.
No, feel free. I mean, very good.
No, it's really healthcare. It's a challenge. It's solving the problem upstream. It's looking at it system wide. And one of the reasons why I'm an independent is because I don't have an allegiance to the party. I can do, and I always have, but not being part of the Democratic or Republican Party, I'm going to do what I think is in the best interest of Delaware and all Americans. And also, I talk about the influence of money. You mentioned about lobbyists and the lobby power. That doesn't affect me. I've eradicated the influence of money from my campaign. I will not take money funds from anybody or any lobbyists, and that really I'm here to do the job and to get it done, regardless of who, what lobby tries to put pressure on us. They really have no influence over me because I don't need their money.
No, those are all important points. Hopefully, again, our goal with this program, so people can hear these. So because the campaigns are kind of limited, you are, even if you do it really well, there are limitations on who you can actually reach out to. So hopefully, your voice for that. Now, the education is our next topic, and these are because, and maybe you saw them or not, but on the X platform, we started these surveys. Surveys are kind of fun. It's engaging. Some of them are a little bit harsh with some of the people's comments, but I don't mind seeing those problem ones. But I look at number of total responses we get, and then I know this is X, so it's a junk box. So there's a lot of things happening. You can't really just take it too seriously, but you cannot also ignore it. So I always make some adjustments from what I see, but there is a trend that I see, and some of these topics we put it out there. What are the most important things for people? So this is the list is coming from, and I try to address the first 5 at least. So with the education, I know you had 3 kids, but they're already grown up, right?
Yes, they're
Are they
all
all
doing. Say again?
are they all done with high school?
Yeah, actually, they're working in their careers. Some are back in grad school, and one's finishing up college now.
Well, you're a young guy, so I thought you would have one at least in high school. But so the 3 kids. So did they go to private school?
They actually went to, in Delaware, they went to private schools, yes.
Because really we didn't have a choice, right? So like they need to get a good education, and in Delaware, unfortunately, that's not going to happen in the public schools. So what can we do for the public school system in Delaware at least? And then from your position, because it's a nationwide, it's at the country level. So are there other things that can be done from the federal government side that can help the state of Delaware with the education issue?
Yeah, so this is another upstream approach to solving a problem of education, which is a problem not only in Delaware, but nationally, and access to quality education, regardless of zip code. And really what I don't know if people really understand is the importance of education beginning at birth, early childhood education. And not only that, but making sure that kids are born healthy or have the best chance of being born healthy, which means good prenatal care, having a healthy pregnancy so that there's a healthy birth. And then working at early childhood education. The first few years are actually critical to a child's development, neuronal and brain development. And that during that time, that's actually helped set them up for their ability when they get older into secondary school. So I really would focus on early childhood education, prenatal care, making sure that we start up front from the birth of the child so that they're good early childhood education programs from literally day one for every child around the country. So that's requires a national approach to help the states give guidelines and focus on the standards of education so that we can provide those programs and allow every child to have that opportunity. Because with a strong education from day one and a healthy childhood gives the children the best chance to chase their interests and their dreams, whether they want to go on to further education. But studies show that kids that have a healthy childhood and strong education do better in life and better standard of living and can provide better for their family.
Yeah. So from some of the issue that we have, us being, and I mentioned this in other sessions before, us being as smallest or the second smallest, depending on the day, state, I always feel like there are certain things that we can turn into, it can be to our advantage. And that's because we may have a better control on certain issues. And kind of surprisingly, that's not happening. The obesity is, as you know, one of the biggest problems nationwide, but in Delaware, that's even a bigger problem because we are in the top 5, if I'm not mistaken, maybe we may be ranked 3, and with the highest obesity rate. That's one of the reasons with our bariatric program, we have almost every Friday, 3 p.m. We do the Bariatric Friday update with Dr. Ergan, Dr. Ergan. I believe you guys know each other, maybe in the past. So, and it's pretty bad where we have to be in the top 5 in any of the bad topics, like, obesity, some of the crime issues. And, at some point, I'm hoping that we can turn the scale issue into an advantage so that we can address these issues better. But I think that's going to require a lot of, again, effort from not just from state officials' side, but from the public too. Like we all individually have to do a lot of things. to overcome some of these problems. So it's not going to be just you, even if you have every power, let's say. I mean, you wouldn't as a senator, but even if you did, you wouldn't be able to fix it if everyone is trying to make things better altogether, right? So now, Dr. Katz, one of the issues that I see for this election, and it was maybe a lot already happening in the other one as well in 2020. We talk about some tangible issues, economy, healthcare, education, but there are some intangibles that's actually taking way too much time and energy from everyone. So I'm going to ask Sean to maybe bring our surveys. The term woke and the woke culture, I think the way that perception of it and how it's impacting public today, it's we spend a lot of time on those, and very little minority, maybe 0.05% is taking, let's say, 40% of the time that and energy that we have out there. So, this started with the UPenn swimmer, Leah Thomas, I believe 2 years ago, when she actually, or he, was running, she was racing in the men's team and then changed it to the women's team. But, I get my education every day. So I didn't know until that time that, they didn't have to have the operation to be whatever they want to be. So biologically, he's a he. And then it goes into the team and breaks all the records in the women's team. So, but that was maybe the flagship of the woke culture, just because it's getting a lot of attention. Now, I put some surveys out there, and then I'm trying to kind of process these, how much people know about it. Like this is, the question on this one is, in terms of the woke culture, what's the significant impact we expect in the society in the recent years, or do they believe in that? And 76% of the people, they do, negative or positive, but they do believe that this is an important issue. And then we have about 762 people answer this. And our next one is, Sean is bringing those up, whether or not this has a, coming up. Your camera is off, Sean.
On the presidential election, that one.
No, but your camera is off right now. I don't see the screen. Sorry. The second question, actually, I can read it from my Twitter directly. If this is going to play a big role in 2024 election, and while I'm actually telling you this, hopefully Sean will pull this up so you can see it. So the people who answered as yes significantly is 43%. And the ones who said no, not really, is 30%. And one says yes to some extent, that's 27%. So that again, 70% of the people, some way they believe that it is going to impact, it's going to have a big role in the 2024 presidential election. And it's kind of consistent with the first one. And then 831 people answered this one. And the last question on the woke culture was,
are you familiar with it?
No, are you familiar with it? So like, because we want to make sure that people knew what it was, and 6%, no, I'm sorry, 85% said yes, they know what it is, and 8% said no, and 7% said have no idea. So that means 15% didn't know. Now, this, I think, will have some impact overall, as you can see the results. And these are new. This is just a week old. Do you see this as being a big challenge for your campaign, or for anyone's campaign, actually, from both Democrats and the Republican side, and from the independent side, as you are representing that side?
Well, I think the term woke and woke culture, what I've observed over the past several years is that it's kind of a symptom of what's going on in our society. It's creating division in our society instead of if there are issues that need to be addressed, problems with disparities, then we need to work together as citizens and Americans, and that kind of gets to the kind of the value system that I abide by in service. Where the political parties really have a code of conduct, which their core value is to win, and therefore the rest of the rules are sort of off the table. And you can see that in campaigns. And I think a lot of the divisiveness in society and the sort of the the issues that are used to divide so that the campaigns or the parties can get 50+1 to win elections as a result of this, their sole core value of winning. And so what I do is I'm basically getting back to the values. I've thought about what are the values of our society, of the United States, and it's basically the foundational principles of our Constitution, where we agree as American citizens that we're going to abide by our constitutional values of liberty, justice, and equality for all. And so that includes everybody, regardless of your demographic or background or where you are in society. We're all human beings. And the code of conduct I put together is on top of that we abide by the core values and the foundational principles of the Constitution. We recognize our common humanity. We're respectful of everybody. We work for and seek unity among all Americans, and we work together with all Americans to solve problems to improve our society. And these are the foundational principles and the values that we should live by, abide by, treat our neighbors, our fellow Americans, and serve our community. So with respect to woke, I see it as a term and a movement that has been somewhat divisive in our society. Quite frankly, I don't have the stats on it, the data, whether it will impact an election or not. But I'm an independent. I'm focused solely on serving the best interests of all Delawareans and Americans. And it's really I'm not using sort of divisive language. I'm more listening to what are the needs of our citizens and our neighbors, and trying to solve problems so that we can improve the community. So I'm not sure. I'm not really answering whether or not it will have an impact. I don't know, but
there isn't really like one clear, straight answer to this. Just because that's why I was kind of grouping this in the intangibles. So it's just sometimes it goes out of proportion. So as we are trying to be respectful for people, that takes over, and then now participation and celebration of what they do in their life, that's everyone else's own business. It's not our business. So, and I believe that the government has nothing to do, no business in our personal lives, and that's how it should be. But I think I do like the way that you have the code of conduct. So, because if we are following those, then it doesn't have to become a problem, or we don't have to really need to worry about these types of issues, because it wouldn't be an issue because everyone would be following certain guidelines. And honestly, if anyone was asking me the same question, I don't know if I have a good, clear answer to that. So it's just knowing that young voters, they also do have an impact in the election, or the first timers, and how they are being informed is almost like poisonous. Like they hear stuff from social media and they don't even click and see what it says. It's just they look at the headline, and that's how they form their opinions these days. And I'm not trying to be a Gen Z hater, but I'm just trying to tell them that they should really look into things in depth and better understand what real issues are. Because when you look at most of the issues we have with some of our people, when they don't know what's happening outside of our borders, and going to Africa, going to Mexico, any other less developed country, and see what conditions are, what people still have to deal with every day. You may remember Dr. Erkan is from Tigray, Ethiopia, and what they have to go through in the last several years, kids, not having access to certain things, and they are surviving, yet we are discussing which bathroom we need to use, or do we need to have a third bathroom set for the for this minority. That's kind of like, I see that issue being a little bit overrated, and I'm not worried about talking about it. So hopefully we won't see a big impact of that. And again, if we let the voters know, especially younger ones, maybe they will wake up earlier and then they will pay attention a little bit more.
Yeah, I think, you know, the bottom line is we need to be respectful of each other, and we all have differences and we all have some similarities, but being respectful of each other. And you know, another challenge or concern I have is when we talk about education, is that in my opinion, the purpose of education is to teach children, and even when you get into college, how to critically think, not what to think, but how to critically think and evaluate information and assess information. And unfortunately, I think you know, even in the secondary schools and you know, all the way up into colleges and even in graduate schools, the kids are being taught what to think, not how to critically think and make decisions for themselves.
That's a very good point. So, Dr. Katz, we are hoping to bring everyone back this year.
Great.
So we're in the beginning of it, and I know things are going to change probably after summer. So hopefully we can spend more time with you on another episode. Did you want us any last minutes thing that you want to cover that you want people to know?
Well, yeah, there are obviously many things. There's a lot of complex issues, but I appreciate the opportunity. What I ask of, you know, everybody listening and of all Delawareans is to engage in the process, to become informed. You know, I ask you to, you know, sign up for our emails at drmikekatz.com and you know, get information so that you can hear what is going on and make your own assessment, and then to, you know, help spread the word about what's going on. We have tools to spread the word and information and to engage in debate. And ultimately, we have a program. I mentioned that we had house calls to Heal America, where we're actually doing house calls for Delaware. And people can go to our website, and literally we ask every single Delawarean we would like to meet with you. So invite us for a house call and we'll come visit with you in your home or in your neighborhood or in your church, your organization, wherever. But we want to meet with people. We're here, we're doing this so that we can listen to you, learn from you, want to understand what the problems are that you're dealing with, and ultimately how you think we need to fix what's broken.
You know, one of the other things that I'm thinking maybe what we can do is we have our monthly provider meetings. Every quarter we do it in person, but the other 2 months we do it through Zoom. But you are more than welcome to join us.
I'd love to, and we can do that in person. I mean, it's Delaware. Everything's accessible, so it's a great state.
So
it's all local.
So I'll talk to Sean and we'll coordinate something and communicate that with you. Well, this was a lot of information to process. It's great to know you.
Yeah, it's great seeing you.
I wish that we met before while I was closer to you, but it's never too late. So we want to wish you best luck, and then we'll make sure video reaches out to many people, especially in Delaware, and we'll keep in touch. Thank you so much for joining us.
Good. Look forward to it. Thanks so much, sir. Take care. Have a good rest of the day.
All right, so Dr. Michael Katz was our guest today. A lot of good things that he was able to share with us. So we have Danielle
Hall.
Going to be with us next Friday at 2 p.m. She's running for Congress from the Republican side. She will be our first Republican guest. And then we'll continue with other events later on. I'll be back in 3 minutes with Bariatric Friday with Dr. Erkan. We are going to discuss intermittent diet, fasting, and hopefully we'll reach out to a lot of people today. A lot of snow out there in Delaware, so please drive safe. Main roads are open. Don't hit the brakes. Don't speed. Don't slow down too much. Just, you know, be yourself. Hopefully you'll get out of trouble. You'll be out of trouble, but please drive safe, and we'll see you soon.